Thank you, Stephanie. We'll take all the questions at the end in the panel discussion. So I'm now delighted to introduce Richard Lee, who is a clinical professor in the Department of Supportive Care Medicine and Medical Oncology at the City of Hope National Medical Center, where he also leads the Integrative Medicine program. His background and his training has also included experience in China and Taiwan, where he studied traditional Chinese medicine. Richard, your stage.
Great, good afternoon. How's everybody doing after lunch? Right, we got all our good nutrition. So thank you to the conference organizers, Dr. Goff, Dr. Perconi, and others. Really honored to be here and speak with you today. I have to say, I've been really impressed with this meeting. I go to a lot of conferences, and it's the organization, the amount of patient involvement. This is really fantastic, and I'm actually taking notes because I'll talk about a meeting I'm hosting later on, so there's a lot of things I think I can learn from this meeting. So kudos to everybody here, and thank you for joining. So I'm going to be talking about a topic of integrative oncology, which is my area of focus. No disclosures. And so we'll talk about what is kind of integrative oncology or integrative medicine, how does that vary from other things like complementary or alternative, and then we'll think about what is a more holistic approach, talk about the evidence base around specific symptoms such as pain, stress, and sleep. And so when I tell people I'm involved in integrative oncology, sometimes I get some funny looks, especially at these cancer meetings. And then patients often have things they want me to learn, so I get a lot of books and things they tell me to read. And so there's a lot of variety in the area of integrative oncology, and as the cartoon says, Frank started to get a funny feeling that his doctor was a quack. But unfortunately, there's some truth in that, in the sense that there's a lot of misinformation, and the leader of the MSK integrative program used to call it a lot of quackery. In fact, I had a patient on Tuesday who was declining, he had metastatic cancer, declining conventional medicine, and he goes, Dr. Lee, I've been reading the internet. There are a lot of cures out there, and they don't have any side effects. And I said, there's a lot of information out there. I don't know how much of it is accurate. And unfortunately, he said, I'm going to pursue these things. And I think, unfortunately, that's not going to serve him well. So what do we talk about what's out there? What is quackery, what is real? So let's just take a moment, and if anybody, actually maybe I'll try to do some interactive. Do you differentiate between alternative, complementary, integrative? Does anyone think they're the same? Or how would you define alternative? Anybody want to yell out what they think is alternative? Don't be shy. Doesn't include kind of the standard Western medicine? Yeah. Well, what is it? Deworming medication, that might be included. So, generally when we think about alternative, it's something used in place of. So I spent a year in Asia learning traditional Chinese medicine, specifically acupuncture. So sometimes I have patients who say to me, I'm going to use acupuncture to cure my cancer. And I would say that's a pretty alternative approach. I mean, people do that, but not that I would recommend it. And then some people say, well, I'm going to use chemotherapy, surgery, and I'm going to use acupuncture to cure my cancer. And I would say, well, that's more of a kind of a complementary approach. But if you said to me, I want to use acupuncture to help with my pain, help with my nausea, and I'm going to get chemo, get surgery, and all the standard treatments, I would say that's an integrative approach, because it's really bringing together both conventional medicine in a way that's coordinated, personalized, evidence-based, and should be safe for the patient. So really, there should be a distinction between all these things. And not every center that calls themselves integrative is really truly integrative. Now, if you think about the field overall, even the National Institutes of Health has a center. It started as the Office of Alternative Medicine in the early 90s. Then they renamed it as the Center for Complementary and Alternative Medicine. And then in 2014, really named it the Center for Complementary and Integrative Health. And so you can see the terminology is changing over time. They're really trying to move away from the idea of alternative medicine, moving forward with integrative. It's really thinking about those approaches that are developed outside of mainstream medicine. Right? So it's a very broad category. A lot of different things can be included. Right now, NCCIH thinks about integrative complementary alternative medicine. I call it ICAM. There's kind of the natural products, nutritional approaches like dietary supplements, herbal products. You have psychological interventions like meditation, prayer, music therapy. You have physical and body-based therapies such as massage. And then you have things we call mind-body, which is a combination of things like yoga, qigong, dance, tai chi. And then there's kind of an other category, which would include whole body systems, whole medical systems like traditional Chinese medicine, Ayurvedic medicine, energy therapies, and others. So what do we call integrative medicine? I'd like this definition from the Academic Consortium of Integrative Medicine and Health. It's an organization over, I think, 20 years old now. It includes things like Harvard and Mayo and Duke. And they talk about reaffirming the relationship between the practitioner and patient, focus on the whole person, informed by evidence, and makes use of all appropriate therapeutic approaches, providers, disciplines to achieve optimal health and healing. And so what's really important here is it should be informed by evidence. And not everything out there is appropriate for every patient, right? So you have to really personalize that approach for each cancer type, each treatment that they're receiving. And so one model I think about is the yin-yang, right? We have the cancer. We have all their proven modern-day therapies like surgery, chemotherapy, stem cell, immunotherapy we talked about this morning. But we also have to support the patient through that. And we have to think about the whole person, physical, psychospiritual, social. And we have a lot of already therapies that are out there, like palliative medicine. We talked about nutrition, exercise, physical therapy, occupational therapy. We have psychiatrists, psychologists, chaplaincy, spirituality, and then we have social workers, support groups, great organizations like this. And I think another tool in our box is going to be integrative medicine that can really help find new ways to help patients, support you through the whole journey. Now, if you think about what ICAM uses, fairly prevalent. 18% or 1 in 6 are using natural products, supplements most commonly. A lot of relaxation techniques like yoga, deep breathing, meditation, acupuncture, and then also some special diets. And so this is a model that we've been working with, and really think about the whole person. So you have the patient in the center. They come with their family, caregivers, culture. You have all the standard therapies that we're providing. And then we want to surround them with all the right supportive care domains. And so integrative medicine hits certain areas and can really add, again, to the whole spectrum of services that we can provide for patients to get them through the whole journey. So when we think about what is integrative oncology in an evidence-based way, most common topics I run into in my own consultation clinic include kind of a holistic or integrative approach. And we really focus on whole health. A lot of it's nutrition, exercise, following the American Cancer Society guidelines. Some patients are looking for treatment options in terms of, are there other things I can be doing to help with my treatment? So they bring a list of herbs and supplements. Sometimes patients have chronic symptoms that are not well managed with the standard approaches. Right now with the opioid epidemic, really trying to move away from a lot of prescription medications, so there are non-pharmacologic approaches. And then unfortunately I have patients like I just described earlier, patients who are seeking alternative therapies and really trying to provide education, a more scientifically grounded perspective. And then ultimately we want to monitor these patients. So I said to my patient I saw earlier this week, I said, well, when should we see you again? I don't just let them go. I think traditional places will just say, oh, you don't want my advice, you can go seek alternative medicine, good luck, and we close the door. But usually in our clinic, what we try to say is, look, if you want to pursue that, that's your choice, and we respect that, but let's not lose touch. So our plan was to do another scan in 3 months. Hey, if his cancer is shrinking, great. If it's not shrinking, then we provide guidance on what else he could be doing. And so I think it's really important to monitor them. And so I 110% agree with what Stephanie talked about, the role of nutrition. There's also physical activity and just general physical fitness. American Institute of Cancer Research indicates that many cancers are very sensitive to these approaches. And so I think it's important. You'll see, I think liver cancer is listed there, as well as having some response to these kinds of approaches. So I think it's important to think about. So we spend a lot of time in my clinic focusing on the basics of nutrition and exercise as part of their whole holistic plan. If you look at the American Cancer Society guidelines, it's really about maintaining a healthy body weight, exercising regularly, getting enough fruits and vegetables, and limiting processed foods, as Stephanie just talked about, limiting alcohol. You'd be surprised, I actually had a patient with gastric cancer. We were talking about survivorship. He had 5 years out, and he was still drinking like 2 or 3 times a day. And I said, well, that's not the best prevention plan for yourself. So we talked about reducing his alcohol intake. So even a lot of times patients just forget some of the basics here. Okay, and these are the American Institute of Cancer Research recommendations regarding, very similar to ACS. And then an important thing to note is in the bottom right-hand corner it says, do not use supplements for cancer prevention. That's probably my number one question in my clinic, is what supplements should I be taking? And if you look at the data, for most patients, especially in this cancer survivorship, there's no data to support the use of these supplements, but they have been studied. They have been widely studied in randomized trials. So one of the things you have to think about is the biology of cancer. And I like this paper from Sidney Farber. So the Dana-Farber Cancer Institute is partially named for Sidney Farber, whom we consider one of the kind of pioneers of modern-day chemotherapy. If you go back to this original article published in 1948 in New England Journal of Medicine, he developed a medicine that put leukemia into remission, which at that time, leukemia in kids was lethal, and we really had no options. And so he published this paper, and if you look at the background, I think I have it here, the reason he came up with a drug that blocks folate metabolism was that he actually gave his patients folic acid conjugates. He actually gave them folic acid supplementation, thinking it would help them. But instead, he says specifically, when he gave the folic acid conjugates, he found an acceleration of the leukemic process to a degree not encountered in his experience. So what actually happened was if you give folic acid to patients with leukemia, the leukemia will grow faster. And that's why we used to say methotrexate. And we still use methotrexate today for lymphomas, leukemias. We use pemetrexed in lung cancer. The concept is still true today. So when you think about a healthy person who doesn't have cancer, it's probably safe. And whether it's advised, you could say one way or another. But in a cancer patient, the biology is different. And so it may have undue harm. And that's what we have found in multiple trials. And so these are trials I'm going to show here where we've actually tested supplements. So here's a supplement study of beta-carotene vitamin A to prevent lung cancer. But what they actually found was that patients who got high dose in a pill, not through foods, but in a pill, beta-carotene vitamin A, they actually had more lung cancer and a higher rate of mortality than those who got a placebo pill. And actually, there were 2 trials that actually demonstrate exactly the same findings. This is a study in vitamin E where they were trying to do prostate cancer prevention. And they actually stopped the study early because the vitamin E arm had more prostate cancer than the placebo pill. So you're starting to see a trend here where if you give high doses of these vitamins, it actually might be detrimental. Right? And so ultimately, going back to the whole food approach is the right approach. And then there's a lot of things that I get asked about that have been studied and actually shown to have harm, including things like apricot seeds. You might have heard of vitamin B17 or Laetrile. I actually just had a patient asking me about SEACT, and she had hormone-sensitive breast cancer. I had to tell her to stop that because it can actually stimulate growth. There can be organ toxicity, like hepatotoxicity, and even contamination with other compounds that can lead to harm. And so we really have to be very careful. The other thing to think about is that who's producing these? Supplements, at least in the United States, are not regulated by the FDA. And so the safety guidelines are a lot less. And so this is a very interesting study where this lab actually purchased different supplements and then did DNA analysis of their supplements. And as you can see there in the blue, you want blue. Blue is the authentic product, right? So ideally, everything should be blue on this chart. But instead, there are fillers, product substitution, contaminants. And you can even see, like, company A has 0 authentic product, right? C, D, E. I mean, there are some companies who have no authentic product in their supplement. So because it's unregulated, nobody's really checking. So you have to be very, very careful about when you're getting supplements because it may or may not have what you think it has. And so they have to be, really quality controlled. And there can be drug-drug interactions. This is an area of research for mine where we're very concerned about, if you're on chemotherapy or radiation, there could be drug-drug interactions. And we'll talk about beta-carotene in a second, but St. John's wort, green tea, and things can increase your risk for bleeding. So for those undergoing surgery may want to stop some of these supplements. And so as we talked about, because they're not regulated, the quality, the safety, the dosing, there's a lot of unknowns. And so you really have to think carefully, do you want to go down that road and risk some undue harm, either through an interaction or direct toxicity? Now, this is a study that was a randomized trial looking at antioxidants during radiation therapy. And the thought was the radiation therapy would reduce the side effects and prevent future cancers. Unfortunately, what they found was that, they did find that there was a reduction in side effects. So patients who took the antioxidants during radiation had fewer side effects. However, those patients ended up having increased risk for recurrence and a lower survival than those who got a placebo pill. So what they proposed, what they hypothesized is that the antioxidants interfered with the radiation, which probably caused less side effects, but also made it less effective. Right? And so you have to think about these trade-offs very carefully. And there's other studies coming out. This is a more recent study in 2019 where they looked at supplement use before and after breast cancer treatment. And what you're looking for is that kind of red dotted line. The YY means yes, they were using it before diagnosis, and yes, they were using it after diagnosis. And interestingly, patients who took B12 before and after or iron supplementation who didn't really need it seemed to do worse than those who didn't take it. So we have to just be very judicious about our use of supplements. Now, I don't want you to think that I'm against supplements. As long as there's data that it's safe and effective, I'm for that. So, there have been randomized trials of ginger supplementation to reduce chemotherapy-induced nausea. This is a large CCOP study sponsored by the NIH, looking at different doses of ginger. And actually, what's interesting here is that the 500 milligram dose was better than the 1 gram or the 1.5 gram dose. So more is not always better. But that's something you might consider. So sometimes I'll tell patients who have nausea, not controlled by Zofran or Compazine, I'll say, hey, why don't you try some ginger tea, or just buy some ginger and put it in some hot water and drink that, and that'll likely help reduce some of your nausea symptoms, something very simple and safe. Ginseng has been studied to help with cancer-related fatigue. This is another large randomized controlled trial showing that patients who took ginseng. So similarly, you can buy ginseng tea, and something you might drink in the afternoon if you're feeling tired while you're going through treatment. And then, there has been studies of just a regular dose multivitamin. This is a retrospective study showing that just a regular dose multivitamin might help patients with their fatigue and really didn't have undue harm. So really what I tell patients is really, look carefully at the label. Don't use any megadose or high dose vitamins. But if you want to take a Centrum Silver or a once a day kind of vitamin during treatment, because maybe you're not eating well, it might be helpful, and you might feel a little bit better, and it might help kind of round out your nutrition for those who are having trouble eating. And I'd be interested in Stephanie's advice later on. So shifting gears, let's talk about some symptoms. So back pain. Actually, I just recently moved, so I was lifting a lot of heavy boxes, so I injured my back, so I can relate to this. And then, you have back pain, you kind of get a little bit stressed out. You're like, oh, I can hardly move. And this is true, actually. I had more of this. I had less stress, but I was not sleeping well because I had all this back pain. I couldn't sleep properly. But it's kind of what we call a symptom cluster, right? So you have one symptom, it leads to another symptom, and it just kind of it cycles and it makes it worse. So what are ways we can address that? So acupuncture is one option. I've studied acupuncture. Now, again, this one says you got to be kidding. Your back still hurts. He's got 100 needles. So again, more is not always better. I think that's very true in integrative medicine. But there is data that acupuncture can help with musculoskeletal pain. This is actually published in JAMA Oncology recently, looking at it in patients with musculoskeletal pain and cancer survivors. And you can see, compared to usual care, those who got electroacupuncture or auricular acupuncture, that's ear acupuncture, seem to have improvement in their pain symptoms. This is another study in JCO. It's actually it's about 20 years old, actually, where they were just getting ear acupuncture. So what you can see on the left-hand side there says acupuncture versus placebo acupuncture versus another placebo. So they actually had two placebo arms. And what you see is that the pain scores were in the mid-50s, but only the true acupuncture reduced the pain to the mid-30s, versus in the placebo or fake acupuncture, it didn't really change at all. So there are very simple things you can do with acupuncture that can help reduce pain symptoms. This is another pain study looking at massage. This is a large randomized controlled trial looking at massage to help improve pain and mood, and you can see significant improvement in both symptoms with just a simple massage therapy. Now, one thing to keep in mind is that all these techniques have to be modified for cancer patients. So if you see a massage therapist, we don't recommend getting kind of your deep tissue Swedish massage. That's kind of what we call level 5. There is something called the Walton scale for patients, and we really modify the massage technique. So hopefully your massage therapist is familiar with cancer care, knows to avoid your port or other devices, knows to avoid the radiation areas, and then they need to modify it. Maybe level 1 through 3 is generally what most of our massage therapists would use. Mind-body practices, I think the speaker earlier today was talking about meditation. There's a very good evidence, and maybe has the best evidence base in terms of its benefits for cancer patients, for stress and mood disturbance, quality of life. This is an interesting study done by Elvira Lang, I think, over at Harvard, where she did a hypnosis technique during a cancer biopsy. And what she found was that patients who got the hypnosis technique seemed to have less pain and less anxiety as compared to an attention control and standard of care. The other thing you'll notice is that the hypnosis line ends earlier. Those patients who got hypnosis tended to finish the biopsy procedure quicker, so anywhere from 20 to 30 minutes faster. So actually made the biopsy procedure more efficient. They got it over with. And then there's studies of yoga. Actually, it was mentioned to somebody, there's been randomized controlled trials of yoga for sleep among cancer survivors. So instead of prescribing Ativan or prescribing a sleep aid, I will prescribe yoga, or I might prescribe meditation as a way to help them sleep at night. And it's been shown to improve sleep quality. So again, you don't have to run for the prescription. Music therapy is another great therapy that's been studied. This is one study in pediatric populations undergoing lumbar puncture. And you can see children who received a music therapy intervention had less pain and less anxiety as compared to usual care. So again, instead of, for the procedure, instead of them getting Ativan and Benadryl and sedating them all day, we're just doing a simple music therapy intervention. It's over, and they can go home without any kind of long-term side effects for the rest of the day. Well, something I've been interested in more recently is lavender aromatherapy. So this is one of my favorite studies. It's a Japanese study where they actually looked at the specific compounds found in lavender extract. And what they found, they tested the main ingredients of lavender extract, and they found that only linalool causes relaxation in mice. They basically put the mice like in a maze that's stressful for them. And when you give linalool, you just had them smell the linalool. They didn't even ingest it. They just put them in a box, had to smell it for 20 minutes, and then put them into the maze. And then they gave mice like Ativan, and essentially had almost the same effect as giving them a drug, just by smelling it. So I was like, oh, this is fantastic. The other thing, what's great about the study is actually they gave them a drug that prevented them from smelling. And so if you make the mouse unable to smell, it had no effect. And then they actually gave the mice flumazenil, which is a drug that antagonizes Ativan. And so basically it had no effect. So basically they showed it has a similar mechanism and effect as a benzodiazepine like Ativan. So again, you don't have to run for a prescription. And there have been clinical studies of using lavender aromatherapy to reduce anxiety and pain during procedures. So there's actually, I can't go through all the studies, but there have actually been several now. And so I think this is another area we're going to probably do some research around aromatherapy. And what's interesting is that integrative therapies are now being incorporated into national guidelines. This came out a few years ago, 5 years, 6 years ago now, and you can see acupuncture, mindfulness-based stress reduction was a kind of a meditation technique, is considered to have moderate quality evidence to reduce pain for patients with chronic low back pain. The American Society for Clinical Oncology put out joint guidelines with the Society for Integrative Oncology, and they basically recommended acupuncture for things like aromatase-induced arthralgias, musculoskeletal pain, reflexology or acupuncture can also be utilized, massage, as well as hypnosis. So based on all the data I just showed you earlier for these guidelines. And even the National Comprehensive Cancer Network, NCCN, which is often what insurance companies use for standard of care, are now incorporating integrative therapies into their pain guidelines, nausea, vomiting, dyspnea. This is just one example. You can see they have a whole page on integrative therapies for pain now. And so because the evidence base is increasing, now you're seeing national guidelines incorporate them as another important approach. Especially with the opioid epidemic, we want to move away from pharmacologic interventions if we can. And maybe we can use it in combination as well for optimal approaches. So in summary, integrative oncology is part of the spectrum of supportive care, and it's really here to help optimize your cancer journey. A true integrative oncology needs to be evidence-based and personalized. And think about modalities like acupuncture, mind-body therapies, music, massage as ways to help manage your pain, anxiety, stress, and sleep, and other symptoms. So I want to say thank you. And just also want to let you know, if you're very interested in this area, there's the Society for Integrative Oncology. We have our 20th anniversary in Banff, Canada. And next year, we're hosting it at City of Hope in Orange County. So please come and visit us. Thank you again.